What's your good name?
I'm Lingeshwara.
Lingeshwara. As I learned that you have come out from the diabetic mellitus problem. Now you are expressing on your mother's issue. You tell me how actually your mother's problem was and how she is now.
She was having a cardiac blockage. They had to did the angiogram and they found 80% blockage there. Now she's surviving with only 20% respiration. So now doctor said as long as she is there, just continue feed. We cannot do further like that.
How old she is?
And she's only 75.
What her name?
Annapurna. And now
from which place she is?
From Guntur. Actually, she is having that. After doing the angio only, we came to that my 80% block is there, and doctor said we cannot do bypass surgery at this condition because she is so weak. And now they told me to what are the medicines for the cardio. They given the medicine, but now she's not take. Sometimes she takes, doesn't take. Now I come across with this miracle medicine, cardio.
Only cardiovascular support.
Cardiovascular support, and give 1 liter, 30 ml. Sometimes mixing with the water, hot water, and give it.
How many times you are giving?
I try to emphasize to twice morning and evening. I given instruction to my brother. At least I said if she is around, at least give once a day, 100%. Make sure that you give once a 100%. Especially early morning. The moment she brushes it out, immediately give one dose. And that's the only one which is causing her last 1.5 months. She is surviving with that.
So that means now she is not at all having any that feeling to go to the hospital.
No, never. No complaint that some suddenly heartbeat increasing, respiration problem. All this nothing is there. Now she is in the house with a nurse, and now she is slowly. I am feeling slow recovery. I want to get to see. I want to continue this medicine as well.
But now I will give you the right protocol. Yeah. Since of course the cardiovascular alone will give very good results. But still if you take that protocol, what I am actually advising holistically.
Sure.
So that one. Yeah, but she has to take.
She has to take. That's the main thing.
What about this flax diet? Flax diet she is taking. That also we share. That means simply she is taking that cardiovascular.
Because once she improves, then again tell yes, now you are improving. Better you use the medicine further.
Then, okay, let it be now the same thing, cardiovascular.
Thank you.
Okay, thank you.